And we return to one of our top stories tonight. A national study on mental health has revealed a significant reduction in stigmatisation, with more Singaporeans also aware of and able to recognise common mental health conditions. Now, for more insights into this study, I'm now joined by its co-investigator, Dr. Mythily Subramaniam, Assistant Chairman of the Medical Board at the Institute of Mental Health. Dr. Mythily, welcome to the program.
Thank you so much.
Your study, done 8 years apart, has added 2 new conditions, and they are depression with suicidal tendencies and gambling disorder. What is the rationale behind this inclusion?
We were planning this study actually somewhere around the COVID pandemic. And so at that point of time, as you're aware, there was a lot of news about distress that young people as well as even older people were facing. And there was this fear that there would be a lot of suicidality in the population because of loneliness, because of the fact that they may not be able to seek help during the pandemic. And so we wanted to know that are people able to understand that when depression presents with suicidality, it's a more serious condition. It needs someone to seek help almost immediately. So we wanted to know if just by adding suicidality, it results in an increase in the recognition of depression. Are people taking it more seriously? Are they then recommending that they seek help? And we did find that. We found that when we included that one thing, actually people recognize depression better. They were also more likely to suggest medical sources of help for help seeking if they, receive that particular vignette. Gambling disorder actually came about for 2 reasons. It is the first behavioral addiction which has been included in the DSM-5 criteria. And the second reason is gambling is fairly common in Singapore. I think, people do it just as a pastime or something that we do during Chinese New Year. And so we wanted to know whether people are able to distinguish that there is this gambling, which is quite responsible, versus something which is, more sinister, which takes on like a disordered form to it, and whether they are able to recognize it. And then again, where do they suggest that such people should seek help?
Okay, we'll talk about gambling in a while, but when it comes to depression with suicidal tendencies, why is this a very difficult condition to recognize?
It is actually not a very difficult condition to recognize. Suicidality most times means that the depression is more severe. So we wanted to know that whether people are able to, by just adding this one thing, do they see it as a case of depression even more, better, which is the case. And as I said, we also wanted to know whether they are going to then take it that they should just talk to friends and family, which would not be the right response always. Okay. It could be a first step, but, when somebody has suicidality, it is better that they seek help from a professional. And that is what we found, that people were more willing to say that, this person should seek help from a professional if they had suicidal tendencies.
Okay, so what should someone living in the same house or working in the same office do when they start to notice that a person could be going through serious depression or could be suicidal?
It's a difficult conversation to have. It is difficult to ask a person, have you ever thought of doing something to yourself? But I think that conversation is important if we really care about the person. Or if the person expresses the thought, it's very important that we don't feel scared and we don't invalidate the person. So I think just giving them a listening ear, making them think about stressful situations that they have faced in the past, and how did they come out of it? What were some of the coping strategies they applied? Could they apply the similar coping strategy in this particular scenario? Reminding them that there are many people who love them and who care for them, and, could we all help you? But let's say that the person has very clear intention or, a definite intention, then I would really say, make sure that the person seeks help. If necessary, offer to walk with them to an emergency department or to a GP setting, wherever they are more comfortable and depending upon how distressed they are.
So the first step is to actually get them to speak up.
Exactly.
And to talk about it. What about gambling? You were talking about it earlier. When does it go from just being a pastime to becoming a disorder that requires help?
In a very simple definition, we say that a person has disordered gambling when they persistently gamble excessive amounts of money, despite the fact that it has tremendous impact on other aspects of their life. This could be on their family life, this could be on their work, and most importantly, finances. So they need to gamble more and more in order to get the same kind of high. If they don't gamble, they feel very irritable and restless, and they do try to quit gambling, but they're not able to do that. So some of these symptoms give us an idea that it is no longer just recreational, but in fact it is going to a disordered form of gambling.
I want to talk about stigmatization, Dr. Mythily. Stigmatization against those with mental health problems. It is apparently more serious among the older generation. Why is this the case, and how do we shift their societal attitudes?
I think there are a couple of reasons. One is, traditionally, people had a very poor opinion of people with mental health conditions. They saw them as people who would not get better. They were not very sure about the treatment options. And there could even be an element of seeing it as a spiritual possession or a demonic possession. So they had quite a significant amount of stigma. I think as the younger generation started having a much deeper understanding of mental illnesses, they know what causes them. They know that with treatment, people get perfectly fine. They can go back to being as productive as they were before. I think that stigmatization has changed. The other thing is something we call contact theory, which basically means that if you interact with a person of a particular characteristics, and this is not just mental disorder, it could be anything that you typically frown upon, you realize that actually this person is a very nice person. He's just like you and me. And then your attitude changes. As younger people become more open about their challenges with mental illnesses, other young people see that, they are just like us. There is no need to kind of separate them from us. So they are more willing to accept them. And your second question was about what can we do? So actually we posed this question to Posh Po, who heads the Silver Ribbon, and she had an amazing idea. Language, of course, is one thing. Don't just talk to them in English or even Mandarin. Maybe there's a need to speak in dialects, in Tamil, in Malay, to get them to understand this. But she was also saying, could we then rephrase it in such a way that it's not about their mental illnesses or, somebody of their age having it, but what about, in young people, for example, their grandchildren, talking about their health and presenting it to them in that situation. Maybe they will have a better understanding. They'll be able to engage more. And maybe it should be as stories. It shouldn't be like dry lectures that you give them. They would definitely not be interested in them.
It's really about connecting with them.
It's really about connecting with them.
Dr. Mythily, appreciate your insights as always. Thank you so much.
Thank you so much for having me.
That was Dr. Mythily Subramaniam, Assistant Chairman of the Medical Board at IMH.